Hey, Johnny B. We'll get started. You guys can finish your basketball talk over there.
Later.
How could you tell?
Welcome, everybody. So we have Ryan at work calling in from his office. We have Rita on and Dr. Logus is at a funeral. So that's kind of the extent of us. So we have a quorum, but I think we have a quorum, don't we?
Yeah, checking with Sabrina though to see if she's signing on to. All right.
Yes. Did we add up? Okay. All right. So let's call this meeting to order. I'll take a motion to approve the agenda.
I shall move
Second,
as presented.
discussion. All in favor?
Hi.
Approval of the minutes from the January 10th meeting. Take a motion.
A motion to approve.
Here, second. I'll second him. All in favor, say aye.
Aye.
Hi.
Do we have any public comments? Nope, okay, thank you. And any supervisors not seated here to say anything? Nobody's online, okay. Okay, number 6, presentation from Department of Children and Families regarding truancy.
Okay, so we, a while back,
Yes.
there was a request to
Yes.
refresh us on the process for truancy. It's a bit confusing. So we finally were able to work, Lee Wallen and Jenny Velasnik, they're the truancy gurus for the department. When it gets to the department level, but they can kind of give a brief overview of how that works. So I will let Lee Wallen, the director of DCF, and Jenny is the social worker, in youth justice. She does our youth justice access. She's the one who receives the truancy reports. I'll let them.
Do you want us up at the front or should we, can we stay here?
You're fine.
Okay, perfect. So I'm Lee Wallen. I am the Director of Department of Children and Families, and we will talk about truancy. We don't have a presentation for you. We thought this would be a good opportunity for us, for Jenny to talk about that process, that referral process, where they come from, some data that we have from last year regarding truancies, and then give everyone an opportunity to ask questions. What Jenny's going to be reviewing though is the habitual truancy process. We don't get involved in any of the sectors that come in from the county. So this is just the habitual truancy referrals that we receive from school districts. So Jenny.
I'm Jenny Velasnik, and I am the juvenile court intake worker. Like Tanya said, I'm the access worker for youth justice. So the statutory definition for habitual truancy is an unexcused absence from school for 5 days in one semester. Once a juvenile or a kiddo has met that criteria and the school has worked through the truancy packet that our county has prepared and sent to all of the schools that meets the statutory requirements, once they've completed that, they can refer that to me. Things that the school has to do with the family is offer like different kinds of services, different assessments. One of the here kind of lays it out exactly for the school, like what they need to be assessing for. That's something that we do have a lot of communication with the schools about. But it pretty much just asks them to assess for any learning disabilities or social, like some sort of social assessment, like determining that that's not why the kiddo is habitually truant. Once they do that, like I said, it gets referred to me. I reach out to the family. I schedule an intake conference. I learn a little bit more in depth about maybe what's going on. I help connect the families to services. And then we meet as a team to kind of determine what we're going to do with this referral. I think it's pretty fair to say that usually truancy is like there's some sort of other issues underlying that we don't necessarily know about quite yet. And then we work with the Corporation Counsel's office to do a formal petition to court and get that juvenile on a JIPS order. JIPS is Juvenile Unit Protection of Services. And yeah, see what we can do at the county level to help support them in their school attendance and or any other area in their life that they need assistance with. We can also work with them informally you don't have to go through court, which is usually for truancy cases, something that we try to do first if it reaches our level. And I'm gonna refer to that in some of the stats that I put together. So in 2021, we had a total of 20 referrals. 19 referrals, math is not great here. 8 of those referrals were closed out, and at the time that they were closed out, there were open investigations in our child protection unit with the families. 8 of the referrals we did a formal petition on, so that went through the court proceeding. Every referral that we went formal on in 2021, had a previous truancy referral since I've been in this position in 2019. And 3 of the referrals were DPAs. And that's that informal service level that I was talking about. So they had case management in some form from our department. And then in 2022, we had a total of 11 referrals. 9 of them were closed. Of the 9, 5 of them were open in our child protection unit under an investigation or an assessment, initial assessment. 1 of them went formal and they had a previous referral. And 1 of them was a DPA that was completed successfully. Yeah, that's really all I have. Do you guys have any questions? Clarification? Yes.
So on homeschool students, there's no way to check attendance, or are they just out of the picture? The school districts don't have any handle on homeschool students or anything?
When they submit the homeschool application, the public school that they, like the district in which they
District they
reside,
live in?
is not required to like track any sort of attendance. But I don't know if homeschool has to.
But there is a statute that says somebody who is homeschooling for the purpose to avoid the mandatory attendance law. So when we have parents, this has happened a few times over the last 17 years, when we have parents that because of the truancy petition go, yeah, well, I'm gonna homeschool. Then we go into court and we say, they didn't start to homeschool until this petition, so they're clearly homeschooling for the purpose of avoiding mandatory attendance, and we can still get them on an order so that they have case management and all of that. So if it happens ahead of time before the petition, there's really nothing we can do. But if they do it because they don't want to deal with the truancy issue, then we can still become involved.
That's interesting.
And the other thing to keep in mind too, I hope you don't mind that. Anytime a citation is issued, so most of our school districts have municipal courts. So Clear Lake uses Amory's municipal court, and so they have citations for truancies, like just on the one-offs. And those days, we can't use those days as our 5-day count. So by the time it gets to a habitual truancy, they've probably had 20, 25 days. It's probably been long-standing, and then it takes time to get into court. And then if they don't show up, we're rescheduling, and then we've got to personally serve. And so schools can get frustrated because they want somebody to like inject themselves and help this family quickly. But if they're not open to doing something voluntarily, it can take months before we actually get a court order. And that can be frustrating, but once we get that, then, we can carry it through. And every school is different on how they refer and whether they're using citations or not. So, that's the other thing.
I would say in the last couple of years, though, we've had pretty productive meetings with the majority of the schools in our county on kind of creating like that process that's equal across the board. So like everyone's kind of held the same expectation. And I think that's been helpful. At least I've seen it in our department. So.
Because our office prosecutes citations, but basically only for Unity, because all of the other school districts have municipal courts. So those are the only ones where we know whether or not there have been citations and that kind of thing.
we're able to, part of the requirements that the school has to show before they make the referral to habitual truancy is to meet with the parents and talk about the truancy and try to come up.
The school does.
Yes, and try to come up with a solution. So what we can do if the school notifies us is Jenny can go to that meeting, talk to the parents, talk about if this gets to a county referral, what that can look like, possible consequences. And I think that you've been invited to a couple of those meetings.
Yep.
So that can be a nice diversion. Sometimes when parents, or sometimes when a kid hears that you can go into court and get a court order.
And I would say too, and there are the citations over here, excuse me, I've been invited there too and kind of done the same thing, like, all right, this is step one, guys, this is what we're looking at if this continues. And I think that's been helpful. I mean, I haven't seen them back for a formal referral, so.
So the answer to my question would be, it's up to every individual school district to even have a scope on homeschool kids.
I don't think that the public school has to if they're homeschooled.
They don't.
I think that the public school just gets a notification from the state saying this
Yeah.
child is homeschooled now, and then that's it, is my understanding. No one is monitoring their
One-page form.
attendance, their curriculum.
Yeah, and I don't know that there's any requirement for like a parent to track any sort of like attendance or anything like that.
No.
That I don't know if there's not.
There is not.
Okay.
So one-page form that a parent will fill out for homeschooling. And it can be submitted to the school. The state will submit it to the school. And after that, the school is in the dark. There's no follow-up on attendance or curriculum. And the only issue that comes up is if a homeschooled student wants to transfer back in to a public school. And you see that more often than not for a senior year. They want homeschooled students to transfer back to a public school senior year so that they have a recognized diploma from a public school. And where the hassle comes with that is with trying to administrate credits that a public school or a homeschool student has had, trying to match it with that homeschool or with that school district's curriculum and their credits. That's a huge issue.
Assessments,
Say that again?
our assessments are you talking about?
No, I'm talking about if you're homeschooled and you're taking a class from somebody at home in US history, okay? So they bring a sheet of paper back to the high school administrator and they say, okay, my sibling here has had US history for 1 year. Well, what kind? Is it American history? Because the school district may require freshmen and sophomores to have American history 2 years. And on this sheet, it may only say 1 year. And then how many credits do you grant? You know, and satisfactory, unsatisfactory is fine for a grade. It doesn't have to be an A, B, C, D, E grade. But it's the credit issue that comes up. And that's a huge hassle, I will tell you that.
So there's no assessment that
No.
goes on?
No, I mean, you're talking about an assessment for, as a test or something that would,
2 + 2?
no, there is no assessment. The other question I was gonna ask Jenny, what's the average age for truancy? Is it elementary, middle school, high school?
We've done a lot of preaching to the schools in our county to catch them young.
Yep.
I would say that since we've done that, I've seen a lot of referrals at that younger age level. And I think that's why we're seeing a lot of that crossover and that child protection involved, or some sort of child protection involvement with with the truancy cases. Prior to that, so prior to these last couple of years, I would say mostly upper middle school, high school.
Okay. Do you see more families that have truancy against them, where there might be more than one sibling that is out of school?
Oh, yes.
Yeah, we've got a couple of families. or their
Okay.
siblings
Did-
come through.
Can you give me the top 3 reasons that parents would say that their kids are truant or the kids truant?
I can't make them go to school.
That's what they say, yeah.
That's the response I typically get. I think that's a cop out to
Well,
really not want
absolutely.
to get more invested in like the root of the problem.
Yep.
So that's where we work pretty closely with the families to kind of connect them with services. So I would say probably one of our reoffending families, our Hannah Wagner's a new worker in our unit. She's
Mhm.
done phenomenal work with them over this last year or so. And it was not just a kiddo not going to school, it was the whole family really not understanding the importance and not knowing what was out there for help. And they've made tremendous amounts of progress just in this short amount of time. Just because those bigger family issues were addressed rather than just addressing the truancy in one kiddo themselves.
I'm gonna just make a comment on, I'm gonna pick on Lee for a second here. Way back when, 100 years ago, when Lee was doing what Jenny was doing, I appreciated everything that Lee did when we filed truancy. And Unity, of course, is the oddball out because we're not sitting in a municipality. And I think Malia was in on that too. I'll pick on her a little bit because I think for those formal truancies that got to court, the judges were very, very reluctant to put huge sanctions on these kids. You know, they're kids. And always looked at the parents and say, you know, don't give me the excuse that you can't get your kid to go to school. You know, your foot is a size 10, use it. You know, and so I appreciated what you guys did, and I know the hassles that you have with those families. I'm very well aware of that. So thank you for what you do.
Well,
It's-
we had judges order parents to sit in the.
Oh, yeah, we had
classroom
that too.
With their child.
When parents were ordered by the judge to come in and sit in the classroom with the kids, they didn't like that at all.
That's a wake-up call for the
Oh,
parents.
it was a huge wake-up call.
Because this is not like a delinquency. You know, this isn't saying the child is doing anything wrong. This is a protection and services. This is saying we need to provide help. It is not about getting them in trouble.
I've just always felt that Wisconsin has a huge disconnect in any kind of control over homeschooled kids. I've got some neighbors that got 14 kids and dad's got cancer, and see some of the kids in the county statistics, and a lot of these kids are suffering and it's not really their own fault. That's what I feel about. A lot of lax parents out
I
there.
think
More so with the drugs, you know.
and again, I appreciate what you do from the standpoint of doing that informal assessment. Some of the things that you can provide for those kids, you know, which keeps them out of court, that helps an awful lot.
I think a lot of the kids are kind of starving for parenting, and that's where somebody really fills in.
So I'm glad to hear, because it seemed to me, the questions that I got that sort of, I think, started this whole ball rolling 6 or 8 months ago was that point between the school and the county and that referral moment where it's at the school, and then finally it gets to the county. And that's exactly what I think this person was asking me about, is why can't the county get involved here as opposed to here? So I like that you're sitting in on stuff.
Yeah.
Because I think that would really help. What this person was struggling with was not able to get their administrators or whoever is in charge to kick it up. And so they were just dealing with this kid who was constantly, or kids constantly gone. But if you kind of start supporting and poking around before it becomes official county action, that would help this teacher.
And I would say too that I have a very great working relationship with the majority of the schools in our county. I mean, like Clayton and Turtle Lake, we have some residents who can attend that. I would say that I communicate with them the least because they have a lot of Barron County residents, so I don't necessarily see them. But I would say that we have a very good working relationship with the schools in our county,
Okay.
and that probably helps a lot too.
Yeah, that helps with this issue. Any other questions? Okay, thank you. Thanks, you guys. Thanks for all your work. Okay, number 7. Community health.
So the first tree that
Woohoo.
we killed here.
1 maple and 2 oaks.
Great job. I'll pass these out. So we've got the public health gang here to talk about the community health assessment that has been recently completed. You guys share.
Yeah.
If there's extras, I'll give extra copies. So let's, Helen, do you want to introduce them for me while I?
Yes, so we have the two health educators here today, Felicia and Jason, who have taken the lead on our putting together the data for our 2022 community health assessment.
You have another handout coming your guys' way. Sorry, let's divide them up.
I didn't follow instructions very well, sorry.
So we're just gonna give you a really brief summary of the community health needs assessment. So back in August is when we really started looking at this. Our community health assessment is something we try to do every 5 years to address the health needs in our community. So back in August, we looked at creating a survey and finalizing it for distribution starting in September. So we dispersed these CHAWs within our community by the use of community partners and our mass vax clinics from September to November. And then we collected all of our surveys back, and December to February, we analyzed the results and then created the report that you have today. And reading them to you.
And the timeline was a bit consolidated due to public health's focus on the COVID-19 pandemic for, of course, a few years there. So it was a little bit condensed. We have our survey demographics. So in total, we ended up getting 912 survey responses back. And we have some of the survey demographic data on the handout that we passed out. So basically all of the respondents, all but 0.55% were older than 17, so we're adults. So we didn't get a big youth turnout. For our youth data, we used a lot of the youth risk behavior survey data that we get from schools in the county. 44.52% of respondents were 65 years or older. So we were definitely skewed older in the responses that we did get. So it's important, that was an important consideration to keep in mind as we were looking through and analyzing the data. Just as economics and financial things sort of shift with age typically. And then 92.64% of participants were white, which actually was a slightly lower percentage than what we see at the county level as a whole. So we did get actually a little bit more minority representation, which was great. And then we will go into some of that other stuff later. So
Can I add in something?
Sure.
Our population for 65 plus in Polk County is 31%, so they are a little bit higher, but it does put it into a little bit of perspective that we do have 31% aging population here.
yes, thank you.
Madam Chair and Tanya, can you introduce your team and their titles, or
I'm Felicia.
it would
I'm-
help us a little bit.
Yep, I'm Felicia. I'm a health educator in public health. And I also do the tobacco stuff, so I've seen you guys a few times.
Yes.
I'm Jason. I'm also a health educator. Came on board during COVID, worked a lot in the COVID response. I'm also kind of taking the lead on preparedness side as well.
What all the rest of them?
Oh, they were already here.
Yep,
Got
and then-
Helen, and then Therese is in the corner. She's for public health as well. She helped us. So then, just to dive into some of the priorities that were identified through this process for our health priorities for Polk County, it was substance use and misuse, nutrition and physical activity, and then mental health were our three main identified issues within our county. Health as well.
So we also looked at, so those were the health priorities. Those were the things that we found were things that needed to be addressed in the county. And then we also looked at some of the social determinants of health, so things that seem to be related to our health priorities. And those were things like education, level of education, economic stability, and healthcare quality and access of care. So for education, for instance, we did find some differences in the data amongst those earning less than $25,000 per year and amongst those earning more than $25,000 per year. So there were some, sorry, that was economics. For education, we found that those with some college or more, we found some differences there compared to people with a high school diploma or less. So those were, as you look through the data, when you look through the packet, you'll see that we broke a lot of it down by those levels. And then we also looked at the way that access to healthcare, quality of care impacted our residents as well.
And then I guess our next steps, just to share with you guys, would be to use the information that we've gathered through our CHA, and then we'll start collaborating with community partners to develop our community health plans.
And we do this the improvement plan every year?
Our CHA is done every 5 years.
Oh, okay.
So Tanya, your staff put this whole book together?
In a
Yes,
very
they did.
short time.
Well, we got a lot of homework to do.
I know, get on it, I know.
I got more for you.
Well, basketball's over with now, chief.
Yeah, I know you can read, yeah.
I'm,
It's a quick 40 pages for you.
You send this to some state people.
So you guys are the first ones seeing it. Our CHA process.
So as soon as we get the priorities set in the community health improvement plan, then we share that out more with the community. We'll share that with this group. I believe we send a copy to the state as well. So they know what we're working on.
and do we present it at the full board at some point? We
If
done
you
that in the
would
past?
request that, we could. I don't know, have we before?
I think I've only been here during COVID, so
I think the whole board should have a copy of this.
I think they should have something, don't you think?
And I think the priorities will be key too. I think this group can maybe communicate thoughts, feedback on priorities, and then maybe have you all present, here are our priorities, and maybe next steps might inspire.
Right.
Madam Chairman. Could I make a? Hi, yeah, with this priority setting, I would very much like to, if there's a committee or something about with that, or meet with someone after I get a chance to look it over, which I can pick it up next week.
We could also email it. You want it emailed? Or is
That'd
that-
be brilliant. Or is it too much?
It might be too big, but we'll get it to you, Rita and Ryan.
And I'll be back in town on the 20th, so I will pick that up I can pick it up at your office or something.
We'll make sure everybody gets a copy. You could always maybe share the link. Yep, put it online.
Just coming through this, I sure think that that's kind of the facts that we have is all the county board members understanding what the other committees are doing. This is just an awesome.
But I think social determinants of health plays into everything we do, especially at the county level.
Absolutely.
So yeah, so I think what we'll do too is bring back our little presentation on social determinants of health for next month so that we can wrap our heads around what that means.
Just at first hand, looking at the graphs. There's not a lot of tall men on the graph. You know what I'm talking about when I talk tall men?
What page are you on?
So you have any bar graph. You have one that's like this and all the other ones are like this. So the only ones that I could see where there are tall men or tall people, whatever. Last 2 weeks, how many days have you felt sad or depressed? 1 to 2 days, that's the tall man right there. And then you look at the category of those, less than $25,000, well, that explains everything to me right there. And then associated,
Are you on
Multi-
page 22? Oh, no, what page is that?
23, 22 and 23. And then you see that we have this tremendous access for crisis services. So those are the kickers, okay? It can't, there has to be more than just what's going on page 22 and 23. But I think that's a very important when you're talking about what am I gonna go after? What are we gonna go after, right? And then maybe digging into root cause or whatnot based on the data that you received from this.
And something interesting to keep in mind is just what was the impact that the COVID-19 pandemic had on that crisis services seem to be by far our most utilized service. Were some of our more preventative care services, hindered during that time as well, which is kind of a broad picture to keep in mind.
Right.
Right.
Do we
So-
want to,
Yeah, go ahead.
well, do we, I'm just wondering if the committee wants to digest this and come back next month with a little bit more robust conversation?
Or offline,
What is our timeline?
because
for
you
the-
obviously have
Well, yeah, we don't want to
stuff
slow it
going
up.
on in your head about it. I mean, you're the subject matter expert, so we could do that, but I think it would be easier to sit down and talk with.
You mean individually?
Can we do that? Can we have like little sideline parties?
I would suggest that if, do the homework and then come back and be a part of the goal setting for the community health improvement plan. That might be,
Right, so
have questions.
ultimately, that's the goal.
questions in the meantime can go to Helen, Jason,
All right.
Alicia, me, and we'll get the questions answered.
All right,
Are
cool.
setting those goals, are we slowing you down by, are you saying coming back in our April meeting?
What is our timeline, Helen? I think May, we need to have it in place by May.
You guys want to just keep working and let us kind of try and catch up to you and don't let us slow you down, but then bring us along in April or something, or we
Give
can,
you an update in April.
Hmm?
Update in April.
yeah, something like that. And then, because it sounds like people need to read it
Yeah,
and
yeah, this is,
it's pretty robust. So, and you guys did an amazing job getting this data together so fast and then putting a report together a couple weeks later, basically. So thank you.
Thanks.
I know we're behind this. Okay, does anybody else, any other questions? We'll just come back in April and kind of hear an update. Okay. Update on Golden Age Manor. We,
as a presenter. Thank you guys.
thank you. Thanks, you guys.
Thank you.
It's Dana. Okay, Dana, we can turn it over to you.
All right, can you hear me, see me now?
Hi, Dana.
All right, hello, everybody. So I'll just give you a quick update here from Amory here at Golden Age Manor. So in February, we had our annual survey. And for some of you that have been on the board or remember me talking before, we have a survey every 9 to 15 months from the state survey agency, the Department of Quality Assurance. And with that, we have a health survey and a life safety code survey. So we had both of those in February. They surprised us on a Sunday. They came in, they have to start a very small percentage of their surveys on off hours, off days. So we were lucky this year to have them walk in on a Sunday morning. We had a really great survey. So that was great. For our health survey, we ended up with 3 deficiencies. The average number of health citations in the US is 8.6 and in Wisconsin is 7.9. So with our 3, we were very happy with that. One citation was on provider notification. So there's a number of things in the regulations that we have to notify a provider, so a medical provider of, and there was one instance where a resident's weight had fluctuated and we had notified the provider as timely as they thought we should have. The second one was an infection control citation. Of course, with COVID and everything going on, infection control has heightened on all of the surveys, but it wasn't a COVID related issue, but it was a hand hygiene issue. So as you can imagine, hundreds of many opportunities for hand hygiene in a day in a shift for our staff. We had one nurse who missed a couple of steps in while she was providing wound care. So just a little, just some training that had to happen there. And then our third citation is really a goofy one that we actually get cited on every year because we have one room in our facility, one patient room that's under 100 square foot. So the regulation states that in a private room, the floor space has to be 100 square feet. We have one room that's 96.5 square feet. So with that, they have to cite us on that every year they come. And then we have to say, hey, we're, you know, the risks and benefits, or the cost, I should say, and benefits don't match up to add on that few extra square feet. So that third one, almost, you know, it's just there because of the layout of the facility. And then on our life safety code survey, we received three citations as well. Actually, we had two of our housekeeping closets. They have electrical panels in them. There were carts that were too close to them. They have to have like that 3-foot clearance. And there were a couple of our exits throughout the building that had some snow and ice buildup, thanks to the winter we've had, that weren't as clear as they would have liked them to be. And then just a electrical outlet that needed to be repaired. So very, very small issues all around. So that was great. Any questions on any of that?
I think you did well.
Yeah, it was great. So with that, we just have to write a plan of correction. Our plan of corrections have been submitted and accepted. So we do some audits throughout the year to make sure that those deficient practices are fixed and continue to be fixed. So that's kind of what we've been up to here over the past month. So yeah.
Thank you, Dana.
Yeah.
Okay.
Does she have a count on our residents, number of residents?
Dana, do you have an account on the number of residents that you have right now on site?
Yep. So right now we are still around that 60 mark. We stay kind of give or take a few on either side of that. Lately, I'm just trying to see if I can pull this up quick. You know, like today we're at 62. With our short-term people, we might go from 60 to 64, 58 to 62, kind of in that range. So 62 today. We stay real close to that right now with our staffing and everything.
And I did have a question. How is your staffing? How many vacancies do you have?
Yeah, so I don't have a set number of vacancies right off the top of my head, but you know, we're still struggling, but we have made progress. One other thing we're working on is getting an in-house CNA program back up and running. So hopefully within the next, maybe, I'm not sure the time frame because it all goes through the state, the next few months, we'll be able to do in-house CNA training again. But we have been really fortunate to get CNA trainees in. So right now we're using a training program through the St. Croix Health Center in New Richmond. Their openings are limited. So we have 4 people enrolled in their class that is starting on Monday, the 20th. And then we have another 4 people enrolled in their class that's starting in May. With that, it's probably about 50-50 adults over 18 and high schoolers. So we're making some progress, but we're still, you know, not fully staffed by any means.
Is the cottage full?
Right now, we actually have one opening in there, but that usually doesn't last long, kind of with transitioning people. Sometimes people come out of the cottage to the regular nursing home, but we typically don't have openings back there for long.
What's our full accreditation? 100?
85.
85?
Yep. Used to be over 100, but 85.
Any other questions?
Congratulations, good job.
Thank you.
Thank you. Thanks.
Bye. Okay, update on child support. Is that you, Malia? Or
Is that on? Is Nikki on?
we can come back to it too.
Andy looks like he's ready.
Yeah. Yeah, let's do it. Yeah. He's totally ready. Let's get you out of here. Thank you for sitting there.
So I don't have much for updates. Just recently, the VA has changed their COVID-19 masking policy. So it sounds like what they're going to be doing is allowing each individual facility to set the masking guidelines based on the community numbers, whether they're high, medium, and low. And then also keeping certain parts of the hospital, say for example, like the Minneapolis VA, their spinal cord unit. Of course, that'll be masking for, I don't know, probably forever, you know, but who knows with that. So that's one of the big updates. I think some people are just kind of used to it at this point, or others are fatigued with it. So, yeah, it's kind of interesting to see. I don't know as far as what the COVID numbers are, but to me, I think that's a good sign that things are getting back to normal. And I've just been keeping really busy with all the PACT Act claims. So on August 10th, President Biden signed that into law to basically it's the most robust increase in benefits that the VA has ever seen, you know, for anything from disability compensation claims to healthcare eligibility. So VA started implementing or making decisions on those new claims starting January 1st. So we're starting to see a lot of those decisions come back. So that's kind of, you know, just the bulk of what we're doing is working on PACT Act claims and appeals and things like that. And then there was, through Wisconsin Department of Veteran Affairs, they offered they called it a CVSO supplemental grant this year. It's through ARPA. So we were awarded $15,878 for that. And that can be used. We're going to try to focus on more marketing and outreach this year to try to target those veterans that don't know what's out there for benefits. We still see so many veterans that aren't even aware of what they're eligible for. So I think it's really important for us to try to come up with a plan to outreach and get those veterans the benefits that they're entitled to. So with that, a few things that I plan on doing in the coming months, just some outreach. There's a final affairs event that ADRC is putting on that I'll be attending for that. And then also some type of a scam meeting or presentation that I'll be attending. So that's really it, just keeping busy with all the PACT Act things.
Andy, how many claims have you been working on for the PACT Act?
I didn't bring those numbers with me, but
Okay.
I'm busy. It's probably the most busy that we've ever been. Yeah, I'm probably seeing on average 4 to 6 veterans that are scheduled each day. And then I'm also taking phone calls and walk-ins, so we're keeping busy.
Are you, how are your assets? Well, it's just two.
Me and Gail.
2 assets.
Yeah,
How are you coping with that?
we're doing fine.
Okay.
We're doing good.
All right.
Yeah, we're a good team, so we make it happen.
Yes, you are a good team, but we want to make sure that you
Do you have enough transportation for
have everything you need.
doctors and you got enough people volunteering? Or-
Yeah, I haven't heard any, you know, issues with veterans not getting transportation or rides to VA Medical Center. I think all that stuff is going fine. I haven't heard any reports. I know Laura walked in and I don't want to put you on the spot, but I think everything's going great to what I know.
Yeah, we have a contract rate, a special rate that we do for the veterans, and we've been able to get all of them there. We have the volunteer drivers, and if needed, we have a handicap accessible van to take them. So.
Super.
Thank you.
Anything
Other
else?
questions? Thanks, Andy, for all your
All right.
work.
Thank you.
Let us know if you need help.
Do we want to loop back on that?
Nikki is on.
Yeah,
so we
she's
can-
on now.
Okay, so now we're gonna go back up to 9, child support update. Take it away, Nikki.
There? Yeah, she's there. I think she's trying to unmute.
I'm here. My camera does not want to work. Did
We
it come on?
Yeah, we can see and hear you. Thank you.
Hi. So there isn't a whole lot for me to update. I want to talk about our performance numbers. They've been gradually increasing, so we are improving I think a lot. I think we've been doing really well. The state mandated percentage is 80%. Our court order rate is 85.08. Our paternity rate is 95.55. Our current order rate is still below the 80. It's at 76.82%. But we've now started working additional reports, so workers are knowing what to do to try and increase that. If it's sending an amended income withholding to add a little bit of a administrative amount to pay on arrears, or checking to see if that employment is still even a valid employer. As far as our arrears, we are higher right now than we were at the end of our fiscal year. Right now, we're at 56.19. That's an cumulative percent. So at the end of September, I'm hoping that amount will be much higher. We also have a meeting tomorrow with Economic Services. Diana invited us to have the departments meet so we can better understand things like the referral process and how our two departments work together. Anything, Malia?
Yeah, so one of the things when we're talking about those arrears numbers, those past due amounts, and as Nikki said, it is cumulative. So the fact that we're already at that 50-some% is pretty exciting, because that means by the time we get to the end of our fiscal year, we'll be maybe actually meeting that performance measure for the first time in 10 years.
Quite a while.
Quite a while. And one of the other things that Nikki's been able to do is she trained all of these new specialists, because we've had quite a bit of turnover with retirements and things like that, to work the way she worked when she was a specialist. And she always had the best performance numbers when she was a specialist. And now all of these child support specialists are doing their casework the way Nikki did. And so we're using way more envelopes, way more stamps, way more, because we're actually filing things when people fall behind quickly rather than waiting until they've got this huge arrears balance. So we're realizing that, we probably need to budget a little bit more for things like stamps and envelopes, because we've just never had this robust of a team and this fully staffed. It's pretty exciting. The only other thing that I would say is there's some issues with what the state asks us to do as it relates to out-of-home care placements with child welfare and getting parents orders when their children are placed out of home. And we get direction from the child support folks at the state, which contradicts what we're told to do with our other hat on with child welfare. So we're trying to get to the bottom of that. But all in all, Nikki's doing a fantastic job. So
thanks.
For us, our collaboration meeting tomorrow will help also with whether the child support is getting proper referrals through our interface system, whether referrals shouldn't be being sent to them and vice versa, which will help probably with some data as well. So having that collaboration meeting is something that we are very much looking forward to, especially with good cost claims and things like that.
Do we have any out of county or out of state placements in child welfare?
I don't think we have any kiddos out of state right now, do we, Lee?
Not out of state. Not residential.
Do we have some out of county and state?
Yeah, we've got in Southern Three. One returned home last week. We've got 2 kids out of county. 3 kids out of county.
Pretty low number for us.
Good.
That's pretty good. Yeah, 3.
Very good.
Any other questions? Thank you.
Thanks,
Thank
Vicki.
you. Thanks for being on.
Hi, have a good day.
Okay, Looks like we are gonna have a transportation study update. And look at this. We have a document.
Pictures.
So I brought Laura down.
Woo-hoo. Thanks,
to
Laura.
help me.
Yeah.
So we met and Barbara was at the meeting too.
Yeah, we should throw one of these in her mailbox.
She has a copy.
She does. Okay.
Yep, this is from the regional planners, so the people who conducted the study for us. We met last Thursday. There were a few people there, I guess, interested parties. That's one of the first listening sessions that we held. I think there was another- is there another opportunity?
No, that was the
The
last
last one.
stakeholder one. We had 3 throughout the study process. And this was the last one.
So I think the last step is that they will come to county board and do a final presentation to the county board at some point. I'm not sure exactly. But this was just a meeting to go through the results of the survey and talk about next steps, maybe some soft recommendations from Edwin, who is our person who pulled all this together and was the contact for us at the regional planning. So we can, I mean, this is another homework, set of homework for you guys to read through. Second tree that we killed today. And so basically what Laura and I are taking from it, the soft recommendation is that we do have some transportation services in the county already. They might not be being fully utilized. So kind of a baby step for us would be to find some way to connect people to those services. So that recommendation back to us was to put our heads together, come up with an idea. We're meeting with Vince later on today to talk about some ideas that we have, and then we'll be able to bring more to the group, the county board, once we have a better idea of what Vince is okay with, what we can do, and what, you know, what limitations we have with resources and whatnot. So not a full blown, there's no tram, I don't think, coming to the county at this point.
Gender grant subway is on their.
Channel.
The study that was sent out did show that the primary users would probably be the elderly, disabled, the lower income, and those just without vehicles.
They did talk a little bit about work transportation and a van service or something like that. Schaefer Manufacturing, they came and I felt like there was some interest, but maybe down the road as we get more of a system established to connect with those manufacturing mostly. I think there was a focus on manufacturing, getting people to those manufacturing jobs. And that they would have some more buy-in and offer some resources to support a van service or whatever we decide.
But jumping right to that wouldn't be successful.
Right, they
So it'd
didn't
be a
feel like,
baby step.
yeah, they didn't feel like that would be a good start out, so looking at what we already have and
And what did you find that were the resources that people don't know exist that we have that are underutilized? Is that some ADRC stuff or?
Ours, but there's also, actually, just last week, we discovered Ranger rides. There's a new one that's out of like Ladysmith that comes into our area. And, you know, it just shows that we don't really know what's all out there. And this year is every 5 years, we're tasked with doing a transportation coordination study. And this is the 5th year. It's time for one this year. And we work with the Regional Planning Commission to get invites out to any, first we dig through, find whatever resources we can out there, invite them to show up to the table and basically get a list of what all resources are out there for transportation, who do they provide services to, what the costs are, different information like that. And then getting all that put together in one spreadsheet and then utilizing that to try to fill gaps. That's the plan. The problem in the past is that there really isn't anyone to take it after that point. So that's where we're thinking, looking at the results of this and the historical issues of lack of transportation coordination around here. We're feeling that we're finally getting somewhere where we might be able to take some action. But yeah, there are different services out there that, even we're stumbling upon them here and there just because we'll see a van driving down the road and of course we write it down real
Yeah,
quick
I
and
do
what the
that.
number is and track them down.
I did have a conversation with somebody starting a business here in the county, and they're going to target transportation to the airport.
Yep.
Just starting, it's premature to say much about it, but I thought based on what
Oh, we
you're
get a lot of calls for those.
doing,
Yeah.
and it's, we can't just jump off the cliff and do the subway or anything, but gradually increasing. And then it's funny how when you start talking about these things and studying them, it's just, there's a demand and people's, it's just not unlike housing now. We're seeing things start to emerge and people are starting to talk and say, I think I could do a business like this. So
more to come. Yeah. Do your homework. Ask if you have questions, me and Laura, email us. If we don't know, we'll send it over to Edwin.
Yeah, and we definitely, we're not at all trying to replace any business out there. We just want to make it user friendly for everyone, so.
So if there's somebody in the county that's wheelchair bound, that needs handicap and a person to help, is there, what do they have to do? Do they healthcare or the hospitals or somebody, do they have somebody through their EMTs, or do we have, if somebody calls into the county, how do you answer that in?
So right now, the way it works is that we have programs that are based on our funding are specifically for elderly and disabled, and we can help supplement the costs of that. So if someone calls in that's within those populations, we have vehicles, we can get them out there, charge a lower cost. If someone does not fit in that, we can utilize our services. However, we're not able to use our funding to supplement, so we would have to charge full price at this time. So then what we would do is talk about what we have, how much it would cost. And then there's also handy lift services. I believe there's another one too. So we would then lay out what the options are for them. And then they can make a decision if they want us to take them or if they want to reach out. We'll give them the contact information and then they can call the other options.
I guess I'm confused here. So if there's somebody out there, and I know some specific cases, so they call in and say, hey, I'm wheelchair bound, I need to get to the doctor, it's an emergency or whatever. Is there a question of cost involved? Is that what you're saying, or am I?
Well, if it's an emergency, we would not take an emergency situation, so they should be calling 911 and getting an ambulance ride. If it's
Yeah, I guess I don't mean.
Okay.
Like an urgent care.
If it's an urgent, if it's.
That's what I mean is urgent care.
Yeah, so, well, there is a cost to the service, and so what we end up doing is covering about half of the cost. The program covers half, and then they would be responsible for half, the way it sits right now.
So if somebody calls in under just, hey, I need a doctor care and I'm wheelchair bound, is there a case that the county would say, well, cost, it's not cost effective for it? Is there a case where the county would say, oh, we can't help you?
If someone is eligible for medical assistance, then they are to use the state program. Thank you. I heard everyone else in the room knew that. So there is a state program that if someone is eligible for medical assistance, the insurance program, then they are to use them And we're not able to unless they want to pay full price. So that would be the only,
I see a confusing situation there where
It is very confusing,
I
and
don't
that's
think
why.
anybody should ever be denied of any service
Yep.
because I can't afford it or that should even come up.
and that's, limited funding. That's kind of the problem that happened with, if you remember the Polk County transportation service that we had years ago with the buses and all that. I don't know if you're around.
I was around.
Yeah. So that closed because that's exactly what happened. There was no guaranteed funding reimbursements and the program just couldn't sustain it. So it had to close.
I guess that's kind of the background of what my thinking is. We used to have this, you never had to worry. Somebody could always be there. And now I think there's a gap and it's kind of unfortunate when a lot of these people, they don't have the funding.
And that's where, as the county board, I guess that just, when you go through your priority list and you have to decide where the money's gonna go, that's one of the things to take into consideration.
I think there's getting less help for the elderly, which I know pretty well. I think there's less help or guarantee that the elderly can have the assistance that they need. I think our county has kind of went away from some of the services to people that really need them. Everybody here is pretty young, man, and it really doesn't hit, to the understanding of the people that really need the service and don't know how to go or where to grasp it.
Well,
I know
and
some unfortunate situations that's
we
hard
have
to
a
take.
lot of programs for the elderly, but you're right. I mean, the funding causes limitations to what we can do. And that's unfortunately the problem.
It is, really is.
If John has a person, don't you think the first stop could be calling your office?
Absolutely.
Yeah, so
Yeah, if
just
you
have them
know-
call ADRC.
Yep.
And then they can get routed around from there.
Thank you.
Yep.
Any other? Okay. You're gonna have a discussion regarding homelessness and unhoused individuals.
I was really excited to tell you about my tour of the recovery house, but it got canceled, rescheduled.
Okay, we
So
could.
we're on for the 21st of March, and I believe that Judge Tolan is even scheduled to attend with us. So, and the district attorney, somebody from CJCC, Don is coming. Yeah, we have a whole bunch of people coming. So we'll tour the tribal recovery home over by Turtle Lake next week and be able to report on it then.
I'm gonna go.
And you're
I
coming to that too.
reconfigured and I can come.
Yeah,
And
okay.
Barbara's working, but she can't come.
Okay, perfect. So that was my update that,
Oh, Denise, we gotta take her. Good.
yeah, okay. All right, otherwise, I don't know, Vince, did you have anything to add?
March 25th.
I did get
No, April.
information on
It's the
pallet
Millennial.
homes, if you've ever heard of pallet homes. And it's just an option. You think about homelessness, or you think of transitory housing. Is there a place to put them? We've got certain facilities like the old motels and stuff are used in some cases. But I did get an invoice sent to me, say, here's what they cost. And I think Barron County is putting in 10 pallet homes for under 300,000. Very tiny. These are smaller than tiny homes, but it would be a place where people would have shelter, water, basic needs, and it wouldn't be a lot of space. But they are, I guess you'd call them very, very small manufactured type homes. So I got a little information there. I found it interesting. As you know, the challenge will be, where would they go? And so I only bring this as an option because if, you know, there was a community that would say, hey, we could use this here, or is there county property or whatever, we could do that. It's an option, but I found the cost interesting. You know, 300,000 for 10. You know, I'm sure there'll be additional cost to that, but something for temporary housing.
Still got a lot of land at the fairgrounds.
Oh, yeah, let's throw that in the mix, John.
There you go.
Smart aleck.
Somebody take a swing at that one.
All right, Denise had a question. You have your hand up?
I did. Shoot. Oh, the Osceola tiny house community, then Agra,
Sacred Falls.
Secret Falls, Agra,
Agra, Agra.
Agra-hood.
Agri- Yeah.
Beautiful idea.
Yeah.
They're, one of the problems is with tiny houses is just like manufactured homes, right? Is that conventional loan and the loan availability for those types of dwellings.
Yeah.
You have to be able to afford a loan. It isn't like getting a VA loan. Well, I think the VA works with you on manufactured homes, but like a trailer house, you can't get a 30-year mortgage on stuff like that. So it ends up being a significant cost.
Yeah.
Even though it is a super cheap option for a homeowner that wanted to do an impoverished potential homeowner for a tiny house. It's the whole loan thing that could be an issue.
I met with the developer of that. I mean, it's not necessarily targeted for low income young workforce housing. It's more of a lifestyle where people choose to do this type of thing with certain amenities that would appeal to them and so on. So, you know, those aren't the inexpensive routes to go, you know, as far as tiny homes. But it is an interesting concept. And I also believe that anything that increases the inventory is going to help the affordability of that starter home. And so we are seeing, and I don't know where on the agenda it would fit in, but we are seeing, this is anecdotally, but I've had probably more contacts with me about projects in the development phase of planning and, you know, asking questions. There are several going up. The ones that you all know about that are public, the St. Croix Falls Impact 7 project of duplexes, which is near, for some of you, near the brewery would be a better descriptor, but others might know it near the park fairgrounds. You know both.
I know it.
But there's a plan that's been discussed with the St. Croix City Council of 20 duplexes. Impact 7, you know, will have certain requirements about income and what percentage goes to what level of income. They are also coordinating that, interestingly, with Northwood Tech. Northwood Tech puts an interesting spin on it because they are designing this neighborhood for people who might want to continue their education at a place like Northwood Tech. They will have facilities, broadband will be key. They will have in a community room, the plan is to have little enclaves where people can go and have meetings, short, small meetings with an advisor or sit and do a Zoom call, that type of thing. So that's helping. And then I've had others contact me about other developments, but they're so early, you know, these things, you'll have a development in the planning phase and it'll start getting momentum and it'll start to build and then they disappear, you know, so, but we are getting a lot of inquiries about housing projects. Given that the county has a limited role in that, you know, we have zoning, but if it's in a city or a village, we don't, that's theirs. So, you know, but they generally check in with us or let us know what's going on. get us involved.
Vince, where are we at with the concept of putting a committee together or that idea of a
Yeah,
housing group?
What I did, if you recall, last meeting was send out all the different resources that we've seen in the state or the region in the hope that people would start coming to me or generating ideas. As people saw, as they come to me, they say, you know, really, these may not fit well with Polk County because they're all city related. They deal with TIF districts, big cities where they have a lot of funds. However, without getting into too much detail yet, people are coming to me with questions and they're bouncing ideas off me related to the county role of providing what kind of incentives can we provide a city or a village to assist them if they have the desire to develop housing in their neighborhoods.
Like additional ARPA funds, if the city doesn't have any ARPA funds left?
Well, you would say county funds because our ARPA funds are now in our general fund right now. The ARPA fund is over, so to speak. Did we have a little left over? Yes. But, you know, so whatever the county would say is, you know, if this is something they wanted to invest in, we would probably have to design it in a way that is fair to any community that wants to participate, to apply for and to utilize those in a way that might add to their incentives to get a developer to come and build or to develop. That's kind of the ideas that have been coming my way.
So are we gonna put together a work group of any kind to kind of hash some of this out, or do you want me
I
to just
think
have
we
people
will.
throw stuff at you?
Well, I think we will, but at
Task
this
force?
point,
Yeah.
with the April meeting, we will have priorities set. That might give us a little more indication if housing is one of the
Oh, okay.
priorities, for example, to say, okay, let's start putting together ideas. We can get more staff involved, probably commit more funds, that type of thing.
Okay, so
So
have it pop out of priorities.
right now, I'm asking people, you know, that, you know, and I've had a few supervisors come to me and say, hey, I got an idea. What do you think? And very general sense, that's what I'm getting. So I kind of wanted to do this priority setting and then see where to go.
Okay, I see.
I do know that the West Central Wisconsin Regional Planning Commission has got housing, affordable housing at the top of their list for priorities and goals.
Barbara's on that board. And you are too.
Myself and Sharon.
On West Cap, I believe.
Oh, West Cap.
Yeah,
Yeah,
myself and Sharon.
that's right. Okay. I can also say that Supervisor McAfee and I went to do that housing tour where we looked at the tiny houses. And they're super impressive. They're in Rice Lake, built there. They were sort of small like these, like tiny, I don't remember the square footages, but some of them were like, you know, 150 up to 350 square feet, depending on, because there were some big ones. But the price ranges were similar, you know, starting in the 30s on up to 85 or 100, depending on. And I've always wondered about tiny houses because they're on wheels. How do you deal with them in the winter? But they have a whole winterization that they worked on, because that was one of my big questions is how do you winterize these? So they had a different setup than like a camper. So it was really impressive. I would keep them on the list on how it worked. And
Again, I think most of the, I mean, I'm not a zoning administrator, but I think it would almost have to be a village or a city which lets them come in, because then you have city water, right?
that would be, yeah.
If you do a zoning thing in the county, you're on wells.
You have to
And
do
so
your
you
own
couldn't do
septic,
a well for
yeah.
each little tiny house.
Any other questions? Okay,
Madam Chair.
yes.
Yeah, I'm on the Polk County Housing, on the Polk County Housing Board. I'm the county rep. And it just frustrating to me that, you know, each community, you know, when they initially built, you know, years ago, they had to find a need, you know, and all different things. You had to go around and get potential people that would be part of it and everything. And I keep bringing that up to the board, and I'll be going to the 24th. I'll be going to Wisconsin Rapids as our county rep for our human services. And HUD is in, everything goes through HUD, and it's so regulated, and I just can't believe that the need that there is out there for senior housing, for handicapped people. And I keep asking, well, is there any way that there's gonna be any expansion and meet the needs of some of these people? They just keep saying, oh, we just got all we can do to keep going what we got. There's money for so many things in our state and federal government, and not for the people that need it. Totally frustrating.
Thank you for going.
And I realize, Vince, like you said, you're doing all this work and you got everything ready to go. But come to the actual groundbreaking and there's some kind of stumbling block coming.
Well, there's a lesson. I mean, I think about it as every county is talking about this. Every city is talking about this
Everyone.
in the whole country.
Yeah, it's.
And I will tie it back to broadband. It is sometimes if you choose the path that's right for you and maybe, take a small step as opposed to trying to say, hey, we're gonna build a 8-story building of, 600 places. That's not gonna happen. But I think there are some things we can do to incent local communities that are saying right now, we got some land over here. We should get somebody to develop that. Maybe they don't know how to entice a developer to do that. Maybe the county can help in that regard. Or maybe we could even entice the community to get more active by saying, if you do that, we have this amount of funds available to you. May not be a huge amount of funds, but it may be something that they could offer to a development project that says, one, we want you here, and two, we'll start funding you. And that local community is gonna have to do the expensive stuff like infrastructure.
They've all got an
streets.
industrial
Yeah.
park and they could take a corner of it or something.
Yeah,
Nice kickstart.
yeah.
Okay. Where are we at? Oh, we're at Dr. Logus's item.
Well, you're all interested in it.
We are all
right?
interested.
Okay.
I ran into him the other day, I'll just say, and he said, I have to go to this funeral. I could maybe get there for about 10 minutes. And I said, no, just go. And he said, but I want to know, and the COVID numbers are still there. We're still killing nationwide 350 to 400 people a day. Like, okay. So, yeah.
Yeah, so Helen will give us the communicable.
There you go.
So I have numbers from the last 6 months, so September through March. 1,323 confirmed COVID cases. 27 influenza-associated hospitalizations, which is now starting to trend down. About 32.2% of Polk County residents received at least or got a flu vaccine this year. And then STI cases. So chlamydia, we're at 37. Last year at this time, we had 28 cases. Gonorrhea, we're sitting at 3. And last year at this time, we had 8 cases, and still no Mpox reported in Polk.
So to put that into perspective, 6 months, 1,000 cases was about 10 days worth in our peak.
Yeah.
We're getting 100 cases a day, so rapid decline, but yeah, it's still out there, so.
So what are we at now? Are we medium, low?
Low.
Low. Any other questions on that? Okay, and are you doing the Health and Human
Well,
Services?
we're gonna do this, we're gonna take a third kick at this here. So I brought the paper, because.
Oh, we didn't respond?
Fourth tree that, so we sent out the link and we grabbed the wrong survey. So thank you to the 3 people who completed the DCF survey.
Yeah.
I did do the wrong one.
I gotta do it again.
Nobody asked a question on it. It seems like this is for DCF.
I didn't know. I was like,
So here's paper.
okay.
Please complete.
I could have done it twice.
People who are
The
virtual, we
majority.
will
Yeah.
send you an electronic if you wouldn't mind.
Okay.
completing That we will.
Yeah, I'm electronic. I don't like a paper.
Yeah, we just
Hand
want
it back to her.
just do it, can you just
Do it right now, you mean?
do it right
now.
Oh, do it right now?
Yeah.
Okay.
All right.
Could we finish the meeting and do it, or do you wanna?
Yes.
Okay,
I mean, just so we can start pulling the data.
okay, we'll do, you are locked in the room until you do it.
All right.
Okay,
Okay, so.
legislative event.
We will bring the results next month for that satisfaction survey. Legislative report, you want, I heard Supervisor Bonaprise is going is it March 24th? You're going to?
Yep, and 23rd and 24th
23rd and
in Wisconsin
24th.
Rapids.
And what are the focuses of that?
I don't have the agenda yet.
Okay. And then coming up April 12th, it's Human Services Day at the Capitol. We will, I think we're going to try to send our director team down, but they always encourage board members to attend too. And we'll provide the transportation, lodging and all of that. So if you are a member of this committee board and you want to come, please let me know. We'll
What's the date of that?
April 12th, so it's the day after our next meeting.
I'm sorry?
We would leave April 11th in the afternoon.
Human Services Day at the Capitol. Oh, you're gone. We're all gone. All right.
You guys are gone already?
Yeah, it's like
Okay,
Easter.
so if you are interested, please let me know. We'll be happy to take you down there with us.
Should you reschedule the next meeting? Are you gonna be gone?
I'm here
now?
on the 11th, but I'm gone on the 12th. I leave on the night of the 11th.
Okay.
And then gone on the 12th.
Just as a comment on that, Tanya, that I remember, when was it? When was the last time we went down there? We met with the legislatures, and that is the first time I saw the legislators really that engage in what our problems were. And I thought that that was one of the big satisfactions of really hitting home on some of the, the problem was before that, before we made that trip down there, our funding for the youth was nothing. And then the legislature realized that they made that big mistake. And then they came back with 33% increase the next year. So
Yeah, and what we do is we schedule one meeting with all 4 of our representatives so we can, because you only get a half an hour. So rather than going to each of them for a half an hour, we sit them all down in the same room. We meet up with them. Lisa and I went down January for the CAP team. And I'm telling you, those guys were asking questions and they were so engaged in what we were presenting to them. So it was very nice to see.
yeah, they asked us more questions than
Yep.
what
Yep.
we had for them.
And I would say they came through. One of the items we talked about was some of the frustration with the Department of Regulation and Licensing DPS for getting people through the licensing process. And we had 2 situations in the last 2 weeks. Because the legislator said, email us, let us know if you're having issues with this. And by God, I sent out the email to the 2 individuals that were having issues. They emailed the legislators, guess what? They got phone calls back like within 48 hours from the licensing board. So I was really happy to hear about that because that makes things move along. We can get our staff licensed. We can be doing the business that we're supposed to be doing. So it was a really good experience.
And the key to that, Tanya, is we sat down with the St. Croix County representatives. And so it wasn't just Polk County, it was our area. We represented Northwest Wisconsin, and they sure were sensitive, and we had good things turn out.
Anything else on legislative stuff?
I don't think so.
Okay. Any items for the next meeting? Got anything, Denise?
It's social determinants of health presentation. We've got a strategic plan updates, legislative event report, if any. You'll be able to bring that with you. And then I have program review, possibly the targeted safety funds that we're using in DCF. We've seen a lot of good success. So they will be on the hook for number 2 presentation. It'll be twice in a row. And then we'll, the community health improvement plan.
Is that the grant that you guys are using to
Yes.
Prevent out of home.
Next time we meet, we should be able to talk baseball.
You also talk baseball.
Okay.
That's it.
Baseball, well, I don't know if baseball season will totally be upon us on April. I think we.
I said we're hoping.
We're still gonna
Yeah.
have some snow on the ground.
The track indoors.
Troll hogging will still be open.
Yeah, troll hugging. Okay, I'll take a motion from the mound for adjournment.
So move.
Second.
60 foot 6 inches.
Exactly. But do not leave until you hand your survey in.
Yep. We get it.
And if you need some time, I think we could give it
Yeah,
to
you should
Shavana
go
over
look
in the
at this
clerk's
guy.
office, drop it off with their.
One is
I'm
not
at a
him.
meeting to a funeral.